Good morning, everyone. It is Thursday, April 16th. Yesterday, I gave a talk on surviving and thriving in graduate school. I think it went pretty well. I'll look at the video and then I'll post it here to the YouTube channel. I'm interested to know what you think. One thing that was asked was about how to get over study block and test anxiety. For the study block side of things, I suggest finding someone to study with. You can talk through difficult problems, quiz one another, and formulate questions you think the professor will ask. This idea of guessing the questions is something I've always done myself, and I wonder why students don't do it very often, particularly for a final exam. You had a whole semester with the professor, and you should be able to do a pretty good job of guessing what they might ask about. Most of the time, they signal it quite clearly. For upper level classes and graduate classes, I've sometimes actually asked students to generate questions for an assignment. This also lets me as an instructor know if I'm doing a good job of signaling what's important. Of course, the best way to study is to try to teach someone else something. You quickly figure out where you are fuzzy on the concept. For the test anxiety side of things, from what I've read, cognitive behavioral therapy works pretty well. The idea is to identify self-defeating or unrealistic thoughts that undermine your confidence and concentration during test preparation and test taking. So these sorts of thoughts differ from person to person, but things like, I'm going to fail, I'm not good enough, if I don't succeed, it means I'm not smart enough, everyone else will do better than me, I'll never be able to pass this class. These are fairly common, and essentially what you need to do is to try and change or prevent those negative thoughts from happening. Identify and replace the negative thoughts with ones that are more realistic. I'll study and try my best. Focus on coping and problem-solving skills. If I get anxious, I'll try calm breathing. And then emphasize positive affirmations. I know I can do this. Like everything else, practice really helps. So try to do a rehearsal, a role play, pretend you're in a particular situation, and practice feeling anxious. So find things that make you slightly anxious and practice those, and then increase that anxiety. So for example, I get anxious giving presentations on a stage with a microphone. Not sure exactly why, but I've always had that phobia a little tiny bit. So what I do is that I practice giving my presentation in a situation where I am anxious. I'm also slightly frightened of heights, so I stand on my desk to practice my talks. It gets my heart rate up, it gets me feeling as if I'm nervous, and then I can practice in that state of anxiety. Gradually face these situations and then practice living within it, staying in a situation, helping yourself get used to it. And repeated exposure actually helps you learn, helps your body learn. It's a kind of a biological thing. It helps your body learn that you're not actually going to die in this particular situation. So again, anxiety reduction really does get down to habituation and practice. In terms of the pandemic side of things, I don't have any particular updates today. We will be talking about research labs today. I don't expect to have any major updates on that because the uncertainty is about when we might be able to open is still there. But we are going to try to work out a plan for reopening the labs once we're allowed to. So that's all from me for now. Take care, stay safe, and stay at home as much as possible.